Hello beauties, hello handsome. Thank you so much for stopping by. It's Amara here again. If this is the first time you're stopping to my channel, I wholeheartedly welcome you. You're highly welcome to my channel. Then if you're a returning subscriber, thank you so much for coming back. Today we want to talk about the vagina, a part of a woman's reproductive system, and I want us to look at this because of misinformation that I've been seeing online. I've been seeing people, even I have heard people, they will tell you to add this cooked vegetable soup inside the vagina so that it will smell nice. Cook this kind of delicacy inside the vagina so that it will look tight, like some people say, and other things that they used to say about the vagina. So in this video we're going to clear both the myth that surrounds this and also what you should know about your vagina, and to know when your vagina is healthy or not as a woman. So you must not be a woman to watch this video. You can watch for your daughter, you can watch for your friend. So make sure you watch the video to the end so you're not going to miss anything at all from this video. Now, the first thing I want us to look at, what is vagina? So the vagina is part of a female reproductive system that connects the uterus and the cervix to the vulva from the vaginal orifice. So the vulva is what people even call the vagina, but the vulva and the vagina is two different things. The vulva is a name given to the external female genitalia, and the external female genitalia contains the clitoris, the labia majora and the labia minora, the urethral orifice and the vaginal orifice. Let's take a look at this diagram here. In this diagram, you see this place, these two areas that I'm pointing at now, they are the place that the labia majora, this is an orange, but I'm using it to represent the vulva. Then inside it you see the labia minora. Then on top here you see something like the clitoris. Then inside it you see the vaginal orifice. So this is what people call the vagina, but this is not what the vagina is. This is not what vagina is. So I don't know how to draw. You know, this is the drawing of the uterus. So the vagina is just that area down here that connects this uterus, the cervix, that connects the uterus, the cervix to the external female genitalia. The walls of the vagina are pink in appearance and they are thrown into small folds known as rugae. So this rugae is what allows the vaginal walls to stretch during intercourse and childbirth. Now, the vagina has three functions. I want you to know this. It has three functions. One of the functions is through the vagina that the menstrual flow from the uterus drains out to the vulva. Then it also serves for reception of the penis and semen during sex, and also passage of the baby during delivery. Having known the definition of vagina, I want us to look at how to identify a healthy vagina. But please, before you continue, please can you like this video? Just click the like button, subscribe if you've not, and also share the video so that your friends can see this. So let's go on how you can identify a healthy vagina. These are the characteristics of a healthy vagina. So as I'm doing this, use your own if you're a woman to cross-check. A healthy vagina, we talk about the odor. A healthy vagina has a distinct smell known to every woman and of course their partners or spouse. So this smell is not offensive, neither is it sweet smelling. This is known to every woman. Then a healthy vagina is always moist, which is from secretions of the cervix that comes down to the vaginal wall. Then a healthy vagina produces some discharge, but one thing with this discharge is that it doesn't have a distinct color and is not profuse in nature and is not extremely sticky or creamy. That is the discharge from a healthy vagina. Then the orifice of a healthy vagina always look pink, except in pregnancy or in some medical conditions. So you can take a mirror and check your own to check if all these are okay with it, and this is what makes your vagina healthy. Then we now look at part 3, tips for maintenance of a healthy vagina. So the first tip is avoid douching. Douching is washing of the vagina, as in washing of the inside of your vagina by inserting your hand inside the canal. It's why we say you should avoid this is that the vagina is self-cleansed, and hence it does not need any external washing from you. Just like the way you cannot put your hand and wash your throat, even though the whole food that has been passing there, that is the same thing with your vagina. It self-cleans itself. And this also includes avoid inserting harmful herbal products into your vagina in the name that you want to tighten it or that you want it to smell nice. It will never smell nice. It will not smell like sweet, sorry. And because of the rigor that lines the vagina, it has the ability to come back to its normal shape after sexual intercourse or after delivery. So if you must do this, or if you do this, you may alter the normal flora of the vagina, hence making room for infection. So avoid washing inside of a vagina with your hand. Then the more tips is shower twice daily, and while doing so, use only water to wash your vulva. You now know what the vulva is. Use only water to wash that place. That is one of the things that will help your vagina to be healthy. Then always do Kegel exercise daily to help strengthen your pelvic wall, and of course help to get rid of some particles from your vagina. How to do this Kegel exercise is, when you are urinating as a woman, you can as well do it as a guy. When you are urinating as a woman, try to hold your urine in between. Urinate, hold it, and breathe in for 1, 2, breathe out, continue urinating. Do it again. Try to do it 2 or 3 times every day while you visit the restroom. It helps to strengthen your pelvic wall. Then go for regular health checkup. Then avoid the use of deodorant or perfume on your vagina. I talked about this in one video that I did, 5 things that you must have as a woman. You can check the video up here and you know why I said you shouldn't use deodorant or perfume on your vagina. Then avoid public toilets if possible, but if you cannot avoid it, please use clean water or tissue to clean yourself afterwards. And do not sit on the system. If let's say you want to pass to, do not sit on it. If you must do, make sure it is well cleaned before sitting on that. Then let's look at when you are to seek medical attention. Now we've talked about how to maintain your vagina to be healthy. What are you going to do, or what is it that when you notice it, you now go to the hospital? But before we continue, remember again, I said that you should like this video, subscribe to my channel, and also share the videos. Then these are the tips, these are the things that when you see it, then you know that you need to seek medical attention. Number 1 is changes in your discharge. If you notice as a woman that the discharge that comes from your vagina is becoming profuse, is becoming yellowish, or is looking so milky, or is becoming so sticky, and the discharge has a fishy or offensive smell, then the hospital is calling your name. Then if your vulva or your vagina starts itching you, or it starts being red, or it has this burning sensation that you feel each time you urinate, or you have an unusual bleeding,
or you have sores or abnormal growth,
unusual bleeding this side, you have an unusual bleeding, and this bleeding normally occurs maybe during or after sex, or color change in your vagina when you fully know that you are not pregnant. If you notice any of these 4 signs or more in yourself, then you need to seek medical attention. So guys, I hope that you enjoyed this video. Yes, I hope so that you enjoyed this video, and if you do, please give me like the video, leave a comment, then don't forget to subscribe. If you've not subscribed to the channel, click the subscribe button now. Again, go for before you subscribe. So just go ahead and hit the subscribe button, share the video so that others will benefit from what you are benefiting from. And thank you so much for stopping again. It's your favorite nurse, Amara. Bye.